front of the shoulder. So the special test what we'll do is the speed test. So patient will be in sitting position, therapist in front of the patient. One hand placed at the bicipital groove, where your long end of biceps will come. Other hand at the lower end. Patient in sitting position, one hand at the bicipital groove, another hand lower end of the arm, and ask the patient to do the speed movement without bending the elbow. Can you do the forward flexion? Speed, fast. And if the patient complains of pain in the bicipital groove, it indicates the test is positive. So this is the only the special test which we will do in the examination part. Next. Yes. So to improve the strength of the bicep, the simple exercise is biceps curls. So asking the patient to do the exercise whether in sitting position or in standing position, to do the movements slowly, depending upon the way, again depending upon the capability of the patient, you have to increase or decrease the weight. Then what is the other thing what I told is our shoulder blade stabilization exercises. So patient will be lying on the Swiss ball and doing the forward flexion exercises. So these two exercises will be useful to improve the strength. Next. Again, as usual, range of motion, to improve the range of motion. See, when you are giving the pendulum exercise, when you are giving the pendulum exercise, see that he is not doing very tightly. Ask the patient, make your arm very loose, like in such a, like in air, freely. And ask him to bend forward a little bit. See, sometimes if the patient is doing like this, it is of no use. You know how the pendulum will move? Very freely. That's why the name pendulum exercises. So bend, make it free and move. Do it 4 or 5 times.
نزل كأنك تركع.
Yes. Front and back. Freely. Okay. So you have to ask the patient to do the exercises front and back and even clockwise and the anti-clockwise. So these two exercises again will be useful to improve the range of the motion. Next. This is what I told you, the towel stretch. The towel stretch exercise usually we will do asking the patient to do. Can you remove the knot? Can you hold like this? Yes. And pull front leg. Yes. Which muscle is strengthening? Towel stretch. Your triceps, then your pectoralis muscle and your abductor muscles. So can you do one more time? Up, up, up. Okay. Which muscle is stretching? Where your muscle is stretching? Here. Then your pectoralis. Then what about here? What are these muscles? Here. Your serratus. So these muscles will stretch in the towel stretch. Then flexed elbow stretch. Can you do the second one? Flex elbow stretch. Yes. So yes, correct. Correct. Okay.
Yeah.
So which muscle is no? You have to keep this one straight. Okay. And this one. Stretch it. Now pull this one. So which muscle again here? Your triceps. Then your serratus. Then pectoralis. Your pectoralis. So these 3 muscles will be stretched. Okay. Then the next one. Wall biceps. Can you do like just like this? Okay. Keep the hand like this and no. Okay. And see like this. So which muscle again? Pectoralis. Then your biceps, triceps. What about here? Serratus. So all these muscles will be stretched. Next. So these are some of the stretching exercises in the bicipital tendinitis. That is your towel stretch, your flexed elbow stretch, and wall stretch. Clear? So don't confuse between the exercise between biceps and supraspinatus. So now we'll see the what are the exercise what we will do. Supraspinatus.